The new 22-story Walter Tower at Houston Methodist Hospital offers advanced technology that will transform clinical care and serve as the new standard for similar facilities around the country. The $700 million tower will house the Houston Methodist DeBakey Heart and Vascular Center and Houston Methodist Neurological Institute, both nationally recognized centers.
Cardiovascular disease remains the #1 killer. And as the baby boomers move into their 60s, 70s, and 80s, the demand for sophisticated cardiovascular therapy and beyond will continue to increase.
We are going to be the only place in the world that'll have intraop MRI for the vascular, intraop MRI for the brain tumors, the latest robots, and the Gamma knives. I think the patients will have access to all this technology in one place, which is going to be phenomenal for patients and the surgeons.
Walter Tower will house 366 patient beds and 18 high-tech operating rooms, including 4 hybrid ORs that combine advanced medical imaging devices with an operating room. The new hybrid ORs will allow for more minimally invasive procedures for cardiovascular surgery and neurosurgery.
It allows us to combine the best of image-guided therapy with surgery, all in one place. Instead of saying you're going to a cath lab and you're going to get a stent, you're going to go to the operating room, you're going to get bypass, we now have the ability to mix these, choose the best procedure for the best artery, whether it's surgery or whether it's catheter-based therapy, and it can all be combined at the same setting. There's a dramatic improvement for the patient.
When you're doing a brain tumor, you can take out the tumor, and during the procedure, if you're concerned, get an intraop MRI, which patients will know that you get normally as an outpatient in the OR, look at the results, and then adjust the surgery. This is a very, very efficient way of doing things.
The opening of a new ICU and floor place will absolutely transform the patient experience here at Houston Methodist. Patients in the hospital, they're not even aware of what's happening in an operating room, but they're fundamentally aware of where they spend most of their time, and that happens to be in the patient rooms. And so we really think that the single most important thing to the patient is the marked improvement that's occurring in the patient rooms.
The tower will also feature the latest generation of the Gamma knife that delivers high doses of radiation to the brain with pinpoint accuracy without harming healthy tissue.
We will treat a lot of brain tumors, a lot of the functional neurosurgery without opening the head, without any scalpel, what we call bloodless surgery. So that's going to be a major advancement of having, which you never had before.
Walter Tower also features 14 heart catheterization labs with expanded space and CT conveniently located next to post-op rooms, 3 intensive care floors with all private rooms, 6 acute care floors, a VIP suite, and a helipad that will give emergency personnel direct access to the OR, cath lab, and intensive care units.
The building gives you every option, all focused on the patient. And there is no building or institution I'm aware of that provides so many options at the moment.